active lifestyle demands healthy legs, but vein disorders can certainly slow you down. Dr. Robert Cutchen, founder and director of the Albuquerque Vein and Laser Institute, is back to tell us how we can learn to love our legs again. Good morning.
Thank you. It's good to be here.
Good. Well, first of all, we want to talk about varicose veins. There's all kinds of veins I know, but varicose veins specifically. What exactly is that?
Well, we've talked about this before, and I always like to remind your viewers again because it's kind of hard to understand, but the job of our veins, specifically when we're talking about our legs, is to get the blood out of our legs back up to our heart so our heart can pump it again. So the blood should only flow up. And inside of our veins, we have these little valves. They're like little one-way doors that open to let the blood flow up. And what's pushing them up is when we squeeze our leg muscles, that's what pushes the blood up and out of our legs. And the valves open to let the blood flow up. But gravity's always pulling that blood backwards. And so when the gravity slows that blood down and pulls it backwards, these valves snap shut. And that prevents the blood from flowing back towards our feet. The problem with a varicose vein is that the veins become dilated, or those valves have just given out. And the result is that the valve is broken and the blood flows backwards towards your feet. Well, that puts a lot of back pressure and congestion in the vein, and that's what causes some of the symptoms that we see with varicose veins.
Wow, that's really interesting just to see how that works there. What are some of the symptoms of varicose veins?
Most commonly, people have feelings of heaviness in their legs. They'll feel achy, they'll feel tired. It can range from anything from throbbing or burning or itching.
Wow.
But mostly it's just kind of a heavy, achy, tired feeling in your legs.
So it's not just the appearance then, there's actually some pain from that too.
You know, and some people don't have a lot of discomfort, but for most people, their legs do have some symptoms. And it's not a grueling, severe pain. It's just kind of this heavy, achy, tired feeling that you get. And by the end of the day, you're ready to get off your feet.
Right. Now, is there a certain time frame? When do these set in? Is there a certain age?
You know, the biggest cause is genetics. They just tend to run in people's family. That's the number one thing. People who spend a lot of time on their feet, that will contribute to it. Tends to be a little bit more common in women. Each pregnancy makes them worse. And just a couple days ago, we worked on a patient who was 25, and right after her, I worked on a patient who was in her 70s.
Wow.
So we can see it kind of at every age. It tends to get worse as we get older, though.
Right. Now, can it be damaging to your body?
It definitely can. And for most patients, it's really just something that's causing discomfort in their legs. But for a percentage of people, the varicose veins will actually be damaging to their skin. And I brought a few pictures to show you. Just like smoking, for example, will damage your lungs, varicose veins can damage your skin. That chronic high back pressure in the veins, that pressure gets transmitted out to the skin, and what you get is this discoloration. And these are some pretty rough pictures that I brought, but you can see how the skin gets discolored and damaged. The texture of the skin can even change and get kind of tough and leathery, and you can even develop sores. And here's a patient who's about to develop a sore right on her ankle. And the next picture I've got is a patient who's actually developed an open sore. Now, this isn't the majority of our patients. This is definitely a minority. But if a person starts to see this discoloration, that's the sign that their varicose veins can be getting pretty out of hand and actually causing some permanent damage to their skin.
Once it gets to that point, is that too late? Is it too late to fix it?
Well, kind of yes and no. If someone does develop an open sore on their skin, the good news is in most cases we can close those up. And that has to do with treating the veins, getting rid of the varicose veins, and oftentimes we'll have patients use some compression stockings afterwards. Unfortunately, a lot of that discoloration won't go away. So when it comes to what our goal is to prevent that from getting worse.
Right, so the earlier you get in, the better. Now, how does a person know if the leg discoloration is actually caused by the varicose veins?
That's a great question. Now, there's several things that can cause discoloration, several skin conditions, but the way that we tell if the discoloration is from varicose veins is by doing an ultrasound. And we do this ultrasound with the patient standing up, and that allows us to check their veins and test those valves. Like you see in this video here, we're able to check those valves and see if the blood is flowing up the vein like it's supposed to, or if those valves are broken and the blood's flowing backwards towards your feet. So really, all the answers lie in the ultrasound, and that's what tells us if that discoloration is associated with varicose veins or if it's another skin condition that could be contributing.
So use the ultrasounds to detect it. Now, what do you do for treatments? How do you treat this?
All of our treatments, luckily, the best news is that all of our treatments are done in the office.
Okay.
No more going to the hospital, no more being asleep in surgery.
That's nice.
No more having to kind of rest for weeks afterwards. The treatments that we do now are all done in the office with an immediate return to activity. In the past, people had to have their veins treated with with what was known as vein stripping. And that was a pretty rough procedure done in the hospitals, a lot of discomfort afterwards. And the veins that we previously treated with vein stripping, we now actually close with a laser. We take a long, skinny laser fiber and put it up inside the vein. We numb the vein up and burn the vein with a laser, and we leave that vein in your leg, and over the course of several months, it just disappears.
Wow.
Those people that have those large bulging varicose veins, we actually can make tiny little incisions, hook those veins and pull those out. Sounds kind of rough, but it's not too bad. And then other veins we treat with ultrasound guided injections. Okay,
wow, that's cool. It's kind of like LASIK for the eye, so the procedure's a lot easier with the laser then, I guess.
It really is, and the recovery is a lot better.
Now, what is the role of the compression stockings? You were talking about that earlier in managing these patients.
Now, compression stockings are really important after we do any kind of treatment. We really want to squeeze on those veins after we've closed them, and that helps to hold them closed so that your body will kind of absorb those and get rid of them. Some insurance companies require patients to wear compression stockings before they'll approve any treatments, and that's kind of a game that the insurance companies play. It's kind of a hoop jumping thing. You can stand on your head for 6 months, and these valves in the veins aren't going to fix themselves. But in some people that have more of those chronic skin changes, compression stockings in them are important to kind of support their legs and give them some extra help to get that blood out of their leg and keep the pressure off the skin. So for those people, compression stockings can be beneficial long term.
That makes sense. Now, what is the long-term prognosis for patients with skin damage from varicose veins?
As we discussed a few minutes ago, our goal is we don't want things to get worse.
Right.
And once a lot of that damage has occurred, some of that stuff can lighten up a little bit. But what we don't want it to do is get real changes in the skin texture, have it get real leathery, have it get to where it's formed an ulcer. So the best idea is we want to catch that skin damage early and not let it advance.
Right. Yeah, that is really important for sure. Now, there's also a free screening coming up. Tell us about that. That's on August 15th?
Yeah, when we do vein screenings, our goal is to see patients. It's about 10-minute appointments that we see patients for, and we quickly review some of their medical history and some of the symptoms that they're feeling in their legs. And I take a quick look at their legs and try to decide if we're looking at more of a cosmetic type problem like small spider veins, or if we're looking at a medical problem, if they're having discomfort in their legs.
Right.
So if patients are having some of those heavy, achy, tired symptoms in their legs, those are the patients that are good to come in and take a look at and kind of talk with them about what's going on and what our treatment options are, and talk with them about evaluations.
That's great. Now, what are some of the costs of the treatments for it? Do you know a range?
The best part is that when we're talking about those patients with pain and discomfort in their legs, this is considered a medical problem. So for them, it's covered by insurance. Now, of course, if they have deductibles and copays, all that's going to play in. But the vast majority of what we do, we bill to insurance just like if you had acid reflux or high cholesterol. It's a medical problem. It's not cosmetics. We want your legs to feel better.
Okay. And now you're explaining the varicose veins and the spider veins. The spider veins are the little tiny veins?
They're those little red and purple guys. And unfortunately, in a few people, they can be uncomfortable. But for the vast majority, it's just they're just kind of unsightly. And unfortunately, insurance never covers their treatment.
Because it's cosmetic.
Yes.
Of course. And what about the big veins in your hands? Does that mean anything?
You know, for a lot of people, that's just kind of genetics too. I tend to get some pretty big veins in my hands. For a very few people, they'll be painful. Typically, we don't really do a whole lot with the hands, but you can do some treatments on hand veins if they're really bothersome to you.
Okay, well, cool. Well, very good information there. We're so glad to have you on this morning.
Thank
and
you
don't
so
forget
much.
that free screening, August 15th.